Hello, we are going to do the IV start and hanging the sodium chloride skills checkoff. And so let's get it started. First thing we are going to do is begin with hand hygiene. And I'm going to ensure that I have all of the equipment that I need here. I have my EHR tutor pulled up. I made sure that I have my orders and my MAR ready to go. I have all of the equipment that I'm going to need, including the medication bin. I've got the pad, I've got a pen, my literature, the IV catheter, I've got my tubing, I've got the scanner. Everything is in place, ready to go and laid up in an order that makes sense for me. So I'm going to begin with my checking of the orders to ensure that I am going to give an IV and take blood for my patient whose name is Code Brown. And looking here, I'm scrolling down. I have labs for a complete blood count for today's date, and I have insert peripheral IV with today's date. Perfect. So scrolling back up to the name, Code Brown, I'm going to look at my bin to begin with med check 1. I have Code Brown 61851. On my orders, Code Brown 61851, and on my MAR, Code Brown 61851. I have the right patient. The medication I'm going to be giving is sodium chloride. Let me look at my orders for sodium chloride. Sodium chloride. Let me look at my MAR for sodium chloride. Perfect. I have the right drug. I have the right route. This is given via IV. On here, sodium chloride, it's given IV. In my MAR, it's given IV. The dose is 50 milliliters. I have on here 50 milliliters, and I have on here 50 milliliters. The time that it is to be given, it says that it is to be given at 7:14 on my orders. Over here, it is said to be given at 7:14 on my MAR, and it is currently 7:14. And so I have the right patient, the right drug, the right dose, the right route, the right time. And the last thing I'm going to do is I'm going to check for the expiration date on my packaging here, which is 11/27. And while I'm looking at the expiration date, I'm checking to see if there's any leaking or any particles, anything wrong with the bag itself, and it looks great. So I am good with the pulling of my medication. So I can put down my orders since I am done with that for now, and I'm going to enlarge my MAR. And I'm going to come on right to MedCheck 2. I'm going to scroll up here to check the name again. I have Code Brown here on my bin. Code Brown 61851, 61851. Then I have sodium chloride in my hand here. Roll down to sodium chloride on the MAR. And this is given via IV. It says right here this is given via IV. The dose is 50 milliliters. It says right here 50 milliliters. It is to be given at 7:14 in the morning. It is currently 7:14 in the morning. Okay, so now we're going to go ahead and get ready to prepare this medication. So I have my fluids. I'm going to grab my IV tubing. And so I'm going to clamp my IV tubing here all the way down with the roller clamp before I begin. And I'm going to pull this upside down. I'm going to pull off that. I'm going to take off the piece here. Careful to make sure that nothing is getting tangled. I'm going to insert this inside. And I'm going to squeeze. This is how I do it. Squeeze, flip over, fill up the chamber halfway. If you want to hang this up on the pole, you can. Careful not to let anything drip onto the floor or drag into the trash can. I'm going to slowly undo the roller clamp and watch as my fluid rolls through. If you are struggling to get the fluid to go through, you will verbalize that you do not get any bubbles as you are getting your line prepped. Okay, so my line is prepped here. I'm going to clamp with my roller clamp. I can also clamp off with this little key here. Okay, my medication is prepped. I have that ready to go. I am going to go into the patient's room. Hi there, my name is Sadie. I am a CVCC nursing instructor. I am here today to insert an IV, draw some labs, and start a bag of fluids on you. Will you tell me your name and date of birth, please? All right, Mr. Code Brown, Miss Code Brown, 6/18/51. Thank you so much. I'm gonna double check, make sure that's what I have on my computer here so that I didn't pull off on somebody else's chart. Code Brown, 6/18/51. Perfect, wonderful. I'm gonna close the door here, provide some privacy, and I'm gonna adjust the bed here just so that you're at a proper working height for me. Awesome, so I will be, like I said, working with you today and making sure that we are giving you what you need to help you feel better. Do you have any allergies? Okay, she said no. I'm gonna double check here and make sure there are no allergies on the chart. Okay, so I'm gonna place this protective pad under your arm just so that we don't get any mess anywhere. I'm gonna be working over here to get some things prepared. So I'm gonna grab my short extension tubing here, and I'm going to start by cleaning the hub. On this side, and attaching a flush. And I'm going to prime this over trash can. Has a cap on that side, so I'm going to go nice and slow. I'm going to make sure I don't have any air bubbles. Once that is primed, I'm going to clamp and set this in my working area here. In preparation, I'm going to perform hand hygiene. Do that every time I walk into a patient's room. I get my tourniquet right next to this patient, and get my IV catheter open and ready to go next to the patient here. I like to throw away my stuff as I go. I have my syringe and my blood collection tube prepared. I'm going to open up my Tegaderm, have that ready next to us. I have my extra flush here ready, my alcohol, my chlorhexidine ready to go, and my field is ready to go. I'll place on my gloves. I have been inspecting the arm with my visual to look and see what I see for veins, and now I'm going to go ahead and place the tourniquet 4 to 6 inches above where I would like to go. Ensuring that the two are away. Okay, I have my tourniquet on. I'm going to clean the site here. So I'm going to go from the inside out. And that will take about 30 seconds to dry. To grab my IV catheter. I'm going to look at it, make sure that it's bevel side up. Okay, this is dry. I'm going to grab my non-dominant hand, stabilize. I'm going to lay down my ring finger for stabilization. And I'm going to let the patient know. 1, 2, 3, big stick. Enter in at the appropriate angle. I'm going to go in maybe about halfway. I see flash in my chamber. All right, nice and slow. And I'm going to take my first finger and notice how the rest of my fingers are not moving, just my first finger all the way up to that hub. Okay, now the rest of my hand is going to pull back until almost hearing that click. My non-dominant hand is coming up here to hold pressure. That click just occurred. And while I'm pulling away, it's kind of wanting to come with me. So I'm going to hold it, but really I never let go of pressure. Set that off to the side, let go of that tourniquet, grab hold of my syringe, set it on, twist, 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 pull back. All right, I have the appropriate amount of blood. Going to loosen it up, hold pressure, set that off to the side, grab my extension tubing, attach that on. I'm going to unclamp this and I'm going to flush, not for real, but I'm going to say that I'm flushing it. And it is patent, no signs of infiltration or inflammation. And then I'm going to clamp it shut, take off my flush here. And I'm going to grab my Tegaderm. Place it, securing it best as I can. Around. And I'm going to take this extra piece right here to loop it up. Make sure it's all on. Okay, going to grab my trash with one hand, my sharps with the other. My sharps container is right behind, plop. And I'm going to take my labs and my syringe and I'm going to transfer it. I'm going to label it and I'm going to send it to the lab. I'm going to remove my soiled gloves, perform hand hygiene, and I'm going to label with the date, the time, and my initials. All right. So I went to flow sheets, lines and drains. I'm going to add an IV line. The type is going to be a peripheral IV. The action is insertion. You can also do blood draw, flush. The IV orientation is going to be on the left. The site preparation, we did chlorhexidine. The gauge is going to be a 22. Inserted by Sadie RN. Number of attempts, 1. Patient response, tolerated well. Site assessment, clean, dry, intact. We're not going to worry about any of that. There, I missed a location. Location is going to be in the forearm. Okay. So you can do different dressing types, transparent. There's a lot of information we can put here, but we got what we needed to, and we're going to hit save. Okay. Okay, so I have gone through your vital signs. Looks like your blast blood pressure was 120/70. Your heart rate looks to be about in the 80s. Your temperature was 98.2. Your pain was at a 0. Your respirations were at 14, and your labs are all within normal limits. I verified your vital signs and labs before we begin with the medication here today. The medication that I will be giving is sodium chloride. It's regular fluids. This is usually given for dehydration, and in your case, we are working to increase the volume and replace electrolyte imbalances in your body. A couple of the side effects that I want you to watch out for and be aware of is that it can cause some flushing. It can sometimes make you lightheaded or a little bit faint. And so what I want you to be very aware of is if you need to stand up and go to the bathroom or move from the bed to the chair, be very slow. If you need to use the call light and call me, I'm more than happy to come in and help you with that. So be very cautious in your IV site. If you feel any irritation, if it's red or warm or anything like that, I want you to let me know, just in case there is any infiltration or inflammation. And so far it looks good. So I'm going to move on to my MedCheck 3. I'm going to move back over to the MAR. And this time, I'm going to look at your wristband, Miss Code Brown 61851. Code Brown 61851. The medication we have here is sodium chloride, the right patient, the right drug. Sodium chloride. Sodium chloride. The right dose is 50 milliliters, 50 milliliters. The right route is an IV. We have IV. The right time is to be given at 7:14. 7:14. It is 7:14. And we are good to go. So I'm going to hang this. Let me get my alcohol wipes. Let me get my flush. Pointed on gloves. Make sure I have hand hygiene. And then scan the patient's wristband. Scan the medication. And it's pulled up on my side. So I'm gonna make sure I've got my bubble out of my, and I'm going to scrub here, attach my flush, unclamp, flush, assessing for signs of infiltration and inflammation, clamp it back, remove my flush, and then I'm going to clean it again. And then I'm going to attach my IV tubing here. I'm gonna unclamp here. I'm going to unclamp in the two other spots, unclamp and unclamp. I'm gonna make sure that it is dripping. I'm gonna be assessing to make sure that there's no signs of infiltration or inflammation. Do you feel okay, Miss Brown? Perfect. It is flowing. It is going at the rate of 100 mils per hour, and so with a bag of 50 milliliters, this should be done in 30 minutes. So I'll be back in 30 minutes to check on you. If you need anything, please let me know. I'm gonna remove my gloves, perform hand hygiene, and document my findings. All right, I have given this medication. The time is, I'm gonna change this to 7:14. which is the time that it's to be given. And this is the dose of 50 milliliters per hour. The rate is at 100 mils per hour. So I'm gonna find that, mils per hour. The location, this is gonna be given in the forearm on the left. No pertinent clinical data necessary, no comment, no witness, update chart. This should be good. All right, Ms. Brown, I'm going to go ahead and lower your bed to a nice working position. And if you need anything at all, please let me know. I'm going to perform hand hygiene before I will come back shortly for you.